yes, you have your physician, your house doctor, but you should also create a relationship with your pharmacist, right? Because if there are any questions or concerns, you've already left the doctor's office.
Yeah.
It's at that point where you could have that dialogue and have that conversation with the pharmacist to make sure that, if you have any last minute questions or concerns, if you have some reservations, of course, yes, you can go back to your doctor, but having a pharmacist there is also a point of knowledge and
Yeah. But you're given medication
Yeah.
and you're feeling good in a couple of days, and you're supposed to take this for 5 days. After 2 days, people will say, "Oh, I'm better now, so I don't need to take the rest." Is there danger there?
That's a good question. Yes, there is definitely danger there because it takes a lot of these bacteria to make you actually feel sick. But when you take the antibiotic, for example, for 2 days, studies in, I think, tens of thousands of people have shown that a few might stay behind. Those that stay behind might develop resistance. So for the moment, you might feel better and the disease might be gone. But then the next time that you get something similar,
Yeah.
the antibiotic won't work. So that's why we advise mostly to take for 5 days or 7 days. And that's where the doctor and the pharmacist come and they decide based on what the doctor has diagnosed for how many days you have to take the medication. And we don't want you to take it for too long too.
Oh.
It's just
as prescribed.
Yeah, sometimes I would hear things like, "Please finish
Correct.
the medication."
Yeah.
So I guess...
And I think the finish your medication message is also, when it comes to antimicrobials, to make sure that you are reducing the risk of anything potentially
back.
developing resistance.
Yeah.
Yeah. Yeah.
All right. Do you find that we are somewhat, whether or not properly informed, or may become a little bit nonchalant or don't care too much about this to the point where we are harming ourselves without knowing?
Yeah, and I mean this is one of the public health topics. I think that that can be very dense, right? Because it could be very technical, very scientific, very medical. But I think at the end of the day, it's making sure, for me at least, that people are aware and informed that you need to just take your medications as prescribed, whether it's an antimicrobial or not. And how do you make sure that people feel knowledgeable, whether it's about a disease that they have, maybe it could be a chronic condition, or a flu, for example, or some sort of bacterial infection, but really making sure that they adhere to their medication regime as prescribed by their doctor. So it's not a very flashy, fun topic, but it is important. And I think when I look at it from a public health perspective, one of the things that we need to do is that, really bring home the importance that it is not solely a patient responsibility or a doctor responsibility when you're looking at antimicrobial awareness on a whole. It's making sure that you also keep in mind that there are veterinary, vets are out there. They're prescribing medications to animals within community. So it's also just being mindful that, if your vet prescribes you to, your dog or your cat to whatever medications, that you also, just like a human would, you make sure to finish it, because all of these little actions, if you disregard, could potentially roll into a bigger problem community-wide. So it's not only the human aspects, it's also the animal aspect. Fortunately, I guess for us, we don't really have large farms or anything, but another aspect of antimicrobial awareness and resistance is if we were a large farming or agricultural society, making sure you're mindful to, the antibiotics that you're giving to your animals or your cattle or whatever it is. And so for us, fortunately, we don't have that aspect locally to worry about, but AMR really impacts different sectors of community, and we're trying to do our little part as public health, as pharmacy, as physicians, to make sure that community just understands taking medications as prescribed. There's a reason why you do that.
So this information is basically general in nature, how one can prevent certain things from getting worse. And it has a lot to do with when you're prescribed a particular type of microbial, that you take it wisely and know what you're taking, and the whole 9 yards.
Yeah, and I think, I mean, I don't really know if this happens really much in community, but sharing medications. You know, if I'm not feeling well, hey, you know, can I just use a couple doses of your antibiotics that your doctor gave you?
That is not advisable, you're saying?
That is not advisable. Don't ever share medications. Go to your doctor, have the conversation with your doctor, because what Sander might have, for example, might work for whatever he's sick with. If I'm feeling unwell, I shouldn't share what he's taking. You should go to your doctor and make sure you get your own prescription and your own medication. I don't think that's a big thing culturally on St. Maarten.
Antibiotics and there's a painkiller that is used regularly. I can't remember the name at this moment, but those are common things. Do you have to go to a doctor to get those?
If you are prescribed medications, yes. So I'm saying if you are prescribed an antibiotic and a member in your household might be sick with the same thing.
The other thing that I was just thinking, but couldn't.
Yeah, so paracetamol is something, so that's not prescribed. Over the counter, the household can take that. What I mean to say is if you are prescribed an antibiotic or if you're prescribed something from a doctor for your particular condition, you should not be sharing.
Okay.
I would like to add to this because, for example, we get a lot of tourists, especially American tourists, and I found some numbers, and in America, the health services have found out that 1 in 3 antibiotic prescriptions is unnecessary. And I think every day, American tourists trying to get antibiotics without a prescription. And I think it's very important for both doctors and pharmacists to diagnose these people correctly and for pharmacists to send them to their doctor before giving them antibiotics.
I was about to say, as an offside question, how do you handle something like that? Because certainly you want to help.
Yeah, well, it's difficult. I think for me it's more difficult for local people because a lot of times when they come to the pharmacy for antibiotics, it's because they want to go to work and their sickness is preventing them from working. And then if you tell them no, it can sound like we don't take their problem seriously, but that's not the case. The reason we say no to the antibiotics or we say go to the doctor is because we want to make sure that you are taking the right drug for the right bug. And then for the tourist, well, of course, no one likes to be sick during their holiday, but it's very important for both, so the local person and for the tourist, to educate them, tell them the reason we are sending you to the doctor is to make sure that you are getting the right drug for the right problem and that it works.
So you would normally, in a case like that, if it happens, you would send them to, maybe point to a doctor that they can make a visit and let them, because they would have to speak to the doctor about their condition.
Exactly. So
for them to get the right diagnosis.
So little look into what the doctor does. Most of the time they ask questions and they look at parts of the body and based on that they decide it could be this or this.
Yes.
And they look at what has the highest chance.
Okay.
And then sometimes they're not exactly sure, but the treatment is the same. And that part is very important because once you get a general infection, but you know where to look for medication, then the chance that it's effective is very high. I think.
So associated with these microbial medication, these often comes with some type of parasite or I don't know the right word, but I know what I really want to say. If something is wrong with you, you know, whatever it is, these type of diseases that requires this type of medication. The challenge of knowing exactly what you're going through, unless the doctor tells you, is one thing to handle. But when it comes to prescribing these type of medication, I wonder how it's like. You're not a doctor really, but you can help us understand that we need to do this so that we don't get ourselves in further trouble or the illness becomes worse and that kind of stuff. What parasites are some of the things that have folks being prescribed this? Parasite or fungus or whatever.
Yeah.
Those weird stuff, really.
I think parasites are the most scary looking.
Yeah.
Yeah.
But actually, the amount of parasitic infections here is not that high. You have some worms and you have some malaria cases, but they mostly come from South America.
Yeah.
For fungus, definitely, there's a lot of fungal infections and antibiotic infections too. I think another example for virus infections is HIV, where it's very important that people get the right medication and that the medication works, because it used to be a death sentence, I think 50 years ago, but now people can live with HIV without too much trouble, except for the medication that they have to take. If you go back even further, a cut or a small wound, if it got infected, it would be a possible amputation or a possible death in the past. There used to be some very scary names for it, like the Black Death or the bubonic plague, and those things we don't even know anymore, and it's because of the antibiotics.
So like people who have diabetes, because that is high here, they are most vulnerable when it comes to...
Definitely, yeah. Diabetes, they are, especially if they don't know that they have diabetes, which this is a worldwide thing. A lot of people don't know that they are pre-diabetic or that they have diabetes type 2. Type 1 you get from birth. But these people are more susceptible to infections. And it's the same for HIV patients. Those people have a viral infection, but they are way more susceptible or vulnerable to other infections. And I think the people who are most at danger are the elderly, children, or people who have diabetes or HIV. But the regular healthy person is not completely safe from these infections. Like I said, something might happen with a wound. Maybe you fell off your bike or a car accident. It could be very vulnerable too, because the skin is gone there.
So those are the start of those kind of diseases that require
Developing an infection. That might need to be tackled.
With the microbiome. So what's the challenge though? I mean, obviously this is you're having this discussion because of the recognition of antimicrobial week, but we have some diseases, of course, that are chronic here, like diabetes. Do you think you would need to do more awareness in that regard? Because I mean, you after all, CPS is collective prevention service.
We are definitely trying, and I think the beauty, I always say the beauty is in the collaboration. So I think even, the fact that I'm here with a pharmacist, we did also invite 2 physicians that weren't able to make it, but I think the importance is that we all have the same approach. Globally, the approach is called One Health, where you're basically tapping on all sectors of society to bring awareness. And I think on St. Maarten locally, what's important is that we are pushing a shared message with pharmacies, with physicians, with specialists, with even lab partners, to make sure that at every point in a patient's journey, they feel supported when they get prescriptions, especially antimicrobial medications, that they are knowledgeable, they know how to use it, they know why they've been given it. And so for many years, actually, we've been working on highlighting this week. And what we have done in the last few years at CPS is really engage with pharmacy, really engage with physicians. We had a couple of videos made last year with some colleagues at the Simpson Bay Pharmacy. Is that what it is? Yeah, Simpson Bay Pharmacy. We had a pediatrician film the importance of antimicrobial awareness, what it means. So we're really trying to touch on different partners within the healthcare spectrum to be able to also educate and inform their clients.
Yeah. And what does this mean for CPS though?
I think for us, it's just like any other topic, right? Bringing awareness. So I know that globally, and of course our department, you want to be able to have data and information and numbers to really push the message across, and we're working on that. We are working on looking at how many cases we have of resistant bacteria, or patients that have these challenges, or clients that have these challenges. And it's also making sure that we do our due diligence to collect the data, have the conversations with the medical center, with the specialists, with the pharmacists, looking at prescription practices, to make sure that we get a handle on it, not only from a practical public health perspective, but even on a more policy level, right? So making sure that you engage the community, you engage the healthcare practitioners to make sure that this is prioritized on a national level.
You look like you want to add something. Is there you want to say? Because
so we are also seeing some efforts on island to do specific clinics. We have the diabetic foot clinic now, and that's about the question you asked. There's a specific clinic that looks at patients with diabetes who are more susceptible, and then also for HIV, a lot of patients come to us, and that's very important to have one pharmacy and preferably also one doctor to have all your data in one place. So we can look, are the medications that you are using safe to use with the antibiotics? And also, if the patient comes to the same pharmacy and the same general practitioner or doctor, we can get to know the patients and we know what they want, what their concerns are. An example of this, it's a completely different medication, but someone who is running a lot, if he takes medication for his heart, some medications might stop him from running, and other medications might get down his blood pressure but allow him to continue running.
Okay.
And this could be true for a lot of people working in construction too, where their work is very important for their daily life. And if we prescribe them medications that will make it harder to work for them, then I don't think we're doing a good job as healthcare.
I can remember when you prescribe certain things, they would tell you you shouldn't drive and that kind of stuff.
Yeah, that's a very difficult one.
Yeah,
because it's very important that people can drive here.
Yeah. So, but that's providing information to the patient, to the point where he understands that certain things might be impeded, as a result.
Yeah.
So, is this along the same line, Eva, in this awareness campaign? At least for the week.
Yeah, for sure. For the week.
You need to listen to your doctor.
Yes. And I think, I always look at, to Sander's point, a pharmacist is another provider of information and another resource, right?
Okay.
So it is important to build that rapport, to build that relationship with your doctor, and your pharmacist. You should be able to lean on your pharmacist to ask questions if you have concerns, if you've noticed something. Of course, yes, your physician is always there, but if for whatever reason you can't get seen by your house doctor and you just want to ask a question about the medication or maybe something you're experiencing, I think it's fair to say that you can talk to a pharmacist or your pharmacist, and they are there for information.
I'm gonna go to a break, Sandra, but just I don't know if this is funny to you, but you always understand what is written by the doctor.
That's an art. It's a skill.
So the longer you work at the pharmacy, the more you
recognize what they're trying to say.
But it looks a bit like the waves at some of the beaches.
Okay. Let me take a break quickly. Just lighten it up a little bit. I'm here with Evelista de Weaver. She's head of CPS, and we're also joined by Sander Delweg, who is a pharmacist here on the island at Simpson Bay Pharmacy. We'll take a quick break, folks, get our commercials in. When we come back, we'll button up our conversation and share some more information. Time permits. We'll be right back. Okay, welcome back to the remaining minutes in the hour leading up to 1 o'clock. Not much time left, but we still have with us Evelista de Weaver, along with Sander Delweg, who is here sharing some important information regarding how to prepare yourselves or to protect yourselves when it comes to antimicrobial week awareness and what microbial really is in terms of the type of medication that you should know and have some knowledge of what you're taking and how you should take them. I think that is the most important part. You want to make sure that they understand what they're taking and that they should follow the doctor's prescription. You mentioned something that I think we take it lightly as well. Don't ever take medication that is prescribed for someone else.
Correct. Yeah, especially antimicrobials.
Or share
Exactly.
microbials. And
Yes.
you're talking about like antibiotic, because to me that is very standard for many people, even doctors. You have an illness, whatever it is, a dose of antibiotics.
There's an additional factor here, and that's most medication is meant to be stored below 25 degrees. But the island it's almost never below 25 degrees, maybe in
Uh-huh.
the evenings. And then if you have medication in your medicine cabinet, hopefully,
Yeah.
then it might be okay if it's within the expiration date. But if you have it somewhere else in the house, maybe under a window, the medication can become ineffective more quickly.
So what would be your advice then? To keep it in the fridge or something like that?
I think medication cabinet would be good, or maybe a room that's colder than the other rooms. Anything that's below 25 is okay, but don't put every medication in the fridge, because that could also be a problem.
Okay.
Things like insulins, they belong in the fridge, and liquids mostly belong in the fridge, but pills and capsules, it's better to store it somewhere where there's at least no light shining.
Direct sunlight.
Oh, the direct sunlight.
Yeah, that's the biggest one.
I was just thinking about sometimes as a pharmacist, when you get the patient list, you sort of disappear and then you come back with all the stuff.
You give them the prescription, you go in the back and do
Oh,
whatever
yeah.
you have
Yeah.
to do.
Yeah.
We don't know what you're doing really, but we have to trust that. So it's important. What about the information that you pass on?
Yeah, that's a lot of people don't know what pharmacists do exactly, and there's a lot of steps in there to check whether the medication is right, whether the dose is right, whether it's the right patient, and also see if it's in stock. For antimicrobials, it shouldn't be a problem. They're mostly in stock on island, and then maybe call the doctor if you have questions. But all these steps, once you get to work in pharmacy, you can see why. Because some patients here are twins, same birth date, names could be almost similar, surnames could be almost similar, but then one might have a different reason to be in the pharmacy than the other. And also in hospitals, it's getting better, but patients would be misidentified, and then in worst cases would receive surgical procedures that weren't meant for them. So there's a lot of steps. It's a tedious process, but there's a reason that it's there. And yeah, what we do is, I think it's good for the pharmacy to be more transparent, to be more, talk more with the patient, build a relationship more. Then from the other side also, the pharmacy would appreciate it if patients also see it as a healthcare provider and not as a place where they can get their medication quickly and go home. I understand that when you finish your day and you have to go to the doctor and then go to the pharmacy, you don't feel like it, but those maybe 5 minutes, they can make the difference in whether a medication works or not.
Yeah. What about folks that might be prescribed something and they just don't take it?
Yeah, I'd rather, if they know they're not going to take it, I'd rather they say it at the pharmacy and not take the prescription and the drugs anyway with them, because it's important for doctors and pharmacists to have the right information. If you're taking some medications, there might be interactions with other medications that we will then not give to you. And also, if you're not taking, for example, an antimicrobial, and you come back to the doctor saying, I'm still sick, they will probably not prescribe you the same thing.
one,
They will give you something else. But that second option might be a lot less ineffective than the first option, because there's a reason that it's the first option.
And do we get a lot of folks who would be prescribed certain things and they will come back, they will probably go back to the doctor saying this medication is not working?
Yeah.
And especially microbial type medication. That may be what? Dosage? A problem with the dosage, the amount? Or if you get like the resistance that you're talking about?
Yeah, there could be multiple reasons for a patient to go back to the doctor. I think it's good that they do, because if it's not working, there's definitely a problem. I think for adults, dosage shouldn't be too big of a problem. It could be. I think resistance could be a big one, why it's not working, or maybe the infection was from a different bacteria. So the doctor might have few options where he thinks it could be this or it could be this, and they can be wrong because they make an educated guess. It's like, oh, it's 90% chance that it's this, but there might be a chance that it's something else too. So if it's not working, I wouldn't come back after 2 days, but maybe after the 5 days or 4 days, I think.
But
you
usually
should see
prescribed for
effect,
medication, yes.
There's a lot of things that can influence this. For some drugs, it's very important that your kidneys work well, that your liver works well, and these might extend the time that it takes for medication to work.
Yeah. In the simplest form, how would you, for people to understand microbial, the type of medication that is microbial, how would you simply put it to inform someone that this type of medicine that deals with what, and how do you simplify that?
I would like to put it in the context of something we're seeing a lot in medicine, that a lot of people go more towards natural products. I think social media has a big role in it too, but a lot of antimicrobials are actually natural products. They are derived from the first one that we know was derived from a fungus that was seen on watermelons, and then they found out that they took a piece of the watermelon and they put some bacteria on it, and they noticed that the bacteria died. And for the malaria one, it was from an ancient Chinese medicinal book where they took a lot of different iterations of the book. Then they put together what they had in common, and they found out if there's a certain plant and you boil it in a certain way, then you get the medication.
So you're basically saying that a lot of these diseases can be cured with natural products? That's what you're saying?
Yeah, for
provided that you know what they are.
Yeah.
Because the clinical part of these products, where they manufacture that, is the technology that we use when we get the pill and what have you.
Yeah, so what happened for a lot of these products is they are derived from nature, and then what the pharmaceutical companies do is they make sure that it's the right dose, because it's harder to control the dose with natural products. And then they put it in a pill to make it easier for patients to consume and also protect it from your stomach. And then to easily describe what they are. So I think maybe you could help me out here.
Yeah, so I think, so as I mentioned in the beginning, so you would be prescribed an antibiotic if you are presenting with an infection that is due to you having a bacteria. So if, let's say, you go into your doctor's office, you're feeling, you have a runny nose, you have a headache, maybe you have a little bit of a rash or whatever it is, your doctor would prescribe you an antibiotic. Simultaneously, I think what would be helpful is also to have labs, right? So let's say you do a sample in the lab, let's say a swab. It comes back positive for a bacteria. So now the doctor knows, hey, okay, I've given you an antibiotic because you have a bacterial infection of X bacteria. Please take it for 5 to 7 days. But also having lab diagnostics is a tool to be able to help the doctor to know, okay, yes, I'm making sure I'm giving an antibiotic because you have a bacterial infection. If you have a flu, you should not be taking an antibiotic because a flu is a virus. So it's making sure that, yes, you might feel ill, you might feel sick. The doctors, I think, are very good at having a hunch at what they think you might have, and prescribe you an antibiotic because they're suspecting a bacterial infection. But let's say, for example, you do the labs and the lab comes out to be a virus, then your doctor would say, oh, you know what? Actually, we might need to change the course of the prescription because you don't have a bacteria. You need an antiviral. So it's, for me, that's kind of the simplest way I can put it. It's just making sure that the germ you are fighting
Yes.
gets the right medicine,
Okay.
right?
And that would prevent it from really fighting back if you are
Correct.
following the
The
doctor's
regime. Exactly.
prescription
Exactly.
of a certain drug. All right, and just to wrap it up, where are we with flu? Are we in the flu season?
We
just yet?
are in flu
Because-
season. So I think, naturally, the way I kind of amount to it is when we start seeing a lot of tourists coming down to the island. That's the height of high season, but that's also the height of flu season because it's winter time in northern parts where people are coming down to visit. And naturally, when schools start back, even in August time, you have people mixing, people coming together in small spaces. So, this is the time where things are circulating. We are a tourism island. You will see people from all walks of life coming from all over the world. So yes, naturally, diseases follow. And the flu, COVID, the common cold, those are just some of the things that we expect to see around this time.
Do I know it?
Yeah, there is something going around. The kids were a little bit under the weather last week. So just to also let people know, if you do want to have a conversation, we do have the flu vaccine. I'm working on getting COVID vaccines. But you can also have that discussion with your pharmacist to say, listen, I want to take a flu shot to hopefully
I need
lessen.
a flu shot.
Yeah.
All right. Sandra Delwick, who is a pharmacist, and Eva Lister de Weaver, head of CPS. They were my guests today. I want to thank them for coming in and for sharing this information with the viewing and listening public. Please don't take things lightly when it comes to what your doctor prescribed. Just take all the medication and you will be safe. I want to thank you so much for your time.
Thank you. Always. Always a pleasure. Thank you so much.
All right. We're going to let that be the final word for today, folks. Enjoy the weekend ahead, and we look forward in being back here on Monday at 12 noon, and an invitation is extended for you to join us then. In the meantime, take care, folks. Enjoy the weekend. Goodbye.
This is the voice.